Well, I appreciate the opportunity to join my colleagues on the Senate floor today, and especially the senator from Wyoming, the doctor, who is such an expert on the topic of really not just the moment, not just the day, but the topic of what our country faces. And I would tell you that I do spend a lot of time in hospitals across our state, talking to healthcare providers, talking to patients, to doctors, to administrators, trustees. In fact, there's 128 hospitals in our state. I have visited all of them. And there is just genuine concern about the future of the ability for healthcare to be delivered in communities across our state. And you add to that the physician and other healthcare provider community. This Healthcare Reform Act is creating significant challenges. And my interest in public service started a long time ago with the belief that we live our lives in rural America, in my state of Kansas, in a pretty special way. When I came to Congress, it became clear to me that if our communities were going to have a future, that it was dependent upon the ability to deliver health care close to home. And those rural communities across our nation often have high proportions of senior citizen populations where Medicare is the primary determining factor of whether or not they can access health care. And so when the Affordable Care Act was passed, many promises were made. But one of the things that was sold to the American people, or at least the attempt was made to sell to the American people, is there will be greater access. And I would certainly say that one of the promises that is not being kept about the Affordable Care Act is the likelihood that there is going to be greater access for Americans across our country to health care. Because this bill is underfunded, it's not paid for. The consequences are that the administration's already proposing, Congress will always be looking for ways to reduce spending when it comes to health care, and the most likely target is the payments that Medicare makes to health care providers, which in many instances already doesn't cover the cost of providing the service. And so when we look for access to health care, every time we make a decision every time a decision will be made in order to try to make this more affordable, we're going to see fewer and fewer providers able to provide the services necessary to folks across the country, but especially in rural communities where 60, 70, 80, even 90% of the patients admitted to the hospital are on Medicare. So one of the problems with the Affordable Care Act is the reality that it will reduce the access to health care by people who live in rural America. And we will see fewer physicians accepting patients on Medicare. We will see fewer hospital doors remain open, all done in a way that, as this bill takes $500 billion out of Medicare to begin with, we set, the Congress that passed this, the president who signed this legislation, set the stage for there to be less affordable health care available to Americans across the country, but for especially of constituents of mine who live in a rural state like Kansas. The idea that you're going to keep what you have, that begins to disappear if you're employed, if you're a senior citizen, and Medicare has been your primary provider. Again, back to this idea we didn't bend the cost curve, so in order to make health care affordable, when the legislation fails to do that, we find other gimmicks to do that. And one of the things that this bill creates is IPAB, this independent, so-called independent agency that is going to make decisions about what is covered by your health care plan. And the goal will not be to be better quality health care. The goal of the IPAB will be to reduce expenditures. So as the promise was made that you get to keep what you have, it becomes something totally different than what you've experienced in your health care plan, either in your own private health care insurance or as a beneficiary of Medicare. And so even the president's own Medicare actuary estimates that the law will increase overall national health care expenditures by $311 billion during the first 10 years alone, and that private health care insurance premiums will rise 10% in 2014. So if we're complaining today about the increase in premium costs, there's more to come. 2014, the Medicare actuary says another 10% increase in your health care premiums. At the Center for Medicare and Medicaid Services, their economists found that the increasing growth rate in health care spending will occur in every sector of health care. And more recently, the Congressional Budget Office, our neutral provider of analysis, says the cost of the health care law may be substantially higher than earlier estimated. One of the things I would suggest that we should have done that never happened, if you wanted to keep what you have, if you want to have access to health care in rural and urban and suburban places in the country, one would think we would do something permanent about fixing the reducing payments to physicians, the so-called doc fix. One would have thought in health care reform that would have been front and center. Because if you don't have a physician providing the service, you don't have health care. And yet we have a Medicare system that's going to reduce the payments. In fact, expected this year, it would have reduced the payments to physicians 30%. The reality is that no longer will physicians accept Medicare patients, and that option that you were promised to keep what you have disappears one more time. In fact, town hall meeting, Parsons, Kansas this year, physician on the front row says, "Senator, you need to know that I no longer accept Medicare and Medicaid. I will take cash, but I'm not able to afford to provide the services based upon the Medicare reimbursement rate that I get, and you add all the paperwork in trying to comply with Medicare and Medicaid, and it's no longer financially feasible for me in this small town to provide the services that my patients need under Medicare." We're going to see a lot less access because, once again, the failure, the promise that was made to bend the cost curve down, to reduce health care costs, to reduce premiums, was totally false.